Thank you for joining us. This afternoon, we will be highlighting some of the work that we've been doing at the Center for Cognitive Neurology and our NIA-sponsored and funded Alzheimer's Disease Research Center. It's always a challenging time dealing with Alzheimer's disease and related dementias, but certainly during the COVID pandemic, those difficulties have been magnified. But our faculty have risen to the challenge, as I hope we'll be able to show you this afternoon. And we have exciting and fun speakers that hopefully you'll find educational and entertaining. The challenge of Alzheimer's disease and some of the basic statistics are depicted in this slide. In the USA, about 6.2 million individuals are affected with Alzheimer's disease and related dementia currently. AD is the sixth commonest cause of death. And unfortunately, 1 in 3 seniors dies with Alzheimer's disease or other related dementias. The financial and family caregiver burden costs of these disorders is tremendous. The direct costs of AD care this year are estimated to reach around 355 billion, with these costs rising to huge sums that could potentially bankrupt healthcare in the United States unless we have better interventions. Alzheimer's disease is certainly a very challenging disorder, but over the last 15 months, this has been greatly magnified since, unfortunately, the SARS-CoV-2 pandemic has disproportionately affected our patient population. Alzheimer's disease sufferers are at 3-fold higher risk of having infection with a 2-fold higher mortality. Residents of long-term care communities and facilities have been struck extremely hard in this pandemic. In fact, 34% of reported COVID deaths in the United States were in this community and its workers. So it very much had a disproportionate impact. On top of that, in 2020, there has been a reported excess of some 42,000 deaths attributed to Alzheimer's disease and related dementias, suggesting that there's even an underreporting of COVID-19 in this pandemic and secondary effects of the pandemic that have led to disproportionate mortality. This population also is at very much increased risk of complications from COVID, as I will outline. Despite these great challenges, NYU and the Center for Cognitive Neurology has certainly very much risen to this challenge. And for the first time, NYU School of Medicine is ranked number 2 in the United States for research. And you'll see from this slide that there's been just amazingly fast growth in this ranking in recent years that's unprecedented for any university in the United States. And much of that growth is related to the very hard work of faculty here, bringing in increasing numbers of NIH grants. And in fact, NYU has been number 1 in NIH growth in terms of dollars in recent years, correlating with this increased ranking. And this has been worked through all the faculties here at the medical center, but certainly the Center for Cognitive Neurology has played a leading role as exemplified in this slide. So in 2015, our grant funding uh, from our own programs and affiliated grant PIs was about 45 million. This almost tripled in the current year with a new program project grant among many other grants that have been funded. So this speaks to the tremendous effort from all our faculty. So kudos to those of you listening who are part of this increasing effort and increasing funding. Certainly, with the challenge of COVID, we've tried to very much raise to the challenge and be a part of the story. So we were lucky enough to get a supplemental funding to our Alzheimer's Disease Center to study the impact of COVID-19. And in the one positive aspect of COVID, from speaking to the program officer, submitting the supplemental funding grant proposal and getting a funding decision, that all took a record 15 hours. So we've never experienced submitting an application and getting funding so quickly, but that speaks to the urgency of the problem. And in this work, we've certainly characterized the neurological manifestations in the first wave of COVID at the beginning of 2020 from March, when we had some 4,500 COVID-19 patients admitted, with over 600 having neurological manifestations. Toxic metabolic encephalopathy was the most prevalent of these neurological manifestations. And we've also looked at the 6-month outcomes from a cognitive aspect in these hospitalized patients. And unfortunately, cognitive decline and cognitive symptoms are extremely common, affecting some 50% of these hospitalized COVID patients. We've also been very much interested in looking at biomarkers in the plasma of neuroinflammation, neurodegeneration, and Alzheimer's related biomarkers in this population, using the state-of-the-art technology that's afforded by the biomarker core of our Alzheimer's Disease Center, where we can measure at very high sensitivity these various biomarkers which are listed here. And in our COVID population, comparing COVID individuals with and without neurological manifestations, there's clear, very large increases in neurofilament light, which is a biomarker of neuronal injury, GFAP, a biomarker of neuroinflammation, and phosphorylated tau, which is a marker more specific to Alzheimer's disease and neurofibrillary tangles. These biomarkers also correlated with mortality in these individuals and poor outcomes. So these were very much elevated in folks who were not able to be discharged home. So this speaks to the fact that we believe that these COVID individuals, in particular with neurological and cognitive manifestations, may have an accelerated trajectory to dementia, something that we're very much interested in following longitudinally, with 2 large NIH grant proposals that we have. One has already been put in, and another multi-PI grant proposal will be going in shortly. So looking at the pathogenesis of Alzheimer's disease, it's becoming increasingly obvious from GWAS studies and many other studies that Alzheimer's disease is highly heterogeneous. And in fact, genes related to adaptive immunity, the glia, there are many genes linked to this pathway. Hence, COVID-19, which is affecting the microglial system with neuroinflammation, can play into this. In fact, other viruses have been linked to the pathogenesis of AD, and the CCN is involved in an NIA-funded clinical trial of treating Alzheimer's patients with an anti-herpes virus treatment. Herpes virus simplex has been linked to Alzheimer's disease pathogenesis, but there are really multiple pathways that have been linked. So it behooves researchers in this field to think out of the box and come up with better models that reflect this heterogeneity, and to think of multiple factors that could play into driving Alzheimer's disease pathology. So the speakers this afternoon exemplify this thinking out of the box with trying to develop novel models of Alzheimer's disease. And the first speaker will be talking about Down syndrome, which is the preeminent human model system to study the natural progression of Alzheimer's disease. Dr. Sharfman and Osorio will be talking about the roles of epilepsy and sleep dysfunction in driving Alzheimer's pathology. Dr. Lidlow will be speaking about the critical role that astrocytes and other glia play in neurodegenerative disorders. And Dr. Rees will be speaking about novel cell-based models to better screen for treatments. And ultimately, I'll be speaking about various proteomic methodologies to provide insights into the pathogenesis of Alzheimer's disease. So before we get started, I just want to remind the attendees that at the end of our panel, there'll be a set of questionnaires that will be sent out. So please complete those so that we'll get some feedback on our program and seek to improve it further. At the end of each of the speakers' talks this afternoon, there'll be opportunity to ask a few questions, but also we'll have a question and answer session at the end of all the talks as well. So with that,